children and adolescents have been retained in care, and 94% of those we serve have viral load suppression. Thank you. Next slide. I think that's the last. Now, to take us to the next session, may I introduce Dr. Neema Mlole, who is going to be the moderator for the session. Dr. Neema Mlole is an MD and an MPH and a public health specialist at the President's Office, Regional Administration and Local Government. Dr. Mlole has extensive experience in managing and coordinating HIV interventions at different capacity, including District AIDS Coordinator at Kinondoni District Council in Dar es Salaam. Dr. Mlole focuses on translating Dr. Mlole focuses on translating national level HIV policies into actionable initiatives and coordinates HIV services across 26 regions. She collaborates with ministerial implementers to mobilize resources and strengthen partners to achieve UNAIDS goals by 2030. Karibu, Dr. Mlole. Let's give her a round of applause. Thank you.
Thank you so much, Scholar. Good morning, everyone. It's still morning. Thank you. As we are going to the second part forum, may I call to introduce our presenters so that we can go ahead and discuss what we have in our forum. Our first presenters, I'll start with he's a medical doctor with a public health specialist with more than 19 years experience in primary health care. Currently, he serves as Director for Health, Social Welfare and Nutrition Services at the President's Office, Regional Administration and Local Governments. Apart from that, he also has an experience of 7 years as a Regional Health Management and 12 years as a District Medical Officer. He has a deep understanding in healthcare challenges and solution at various levels. He also serves at the Board of Trustees for Muhimbili National Hospital and Medical Store Department. Through his career, he has made a significant contributors for public health in Tanzania. He had made a successful initiative to improve healthcare access, reduce maternal health and child mortality rates, and combat infection disease. He has experience and expertise in leadership and has instrument in advancing public health care in the country. Welcome, Dr. Rashid Mfaume, the director from the PRAJ. As he walking to take his seat, maybe I introduce another presenters. These presenters, he's a medical doctor. We have a lot of medical doctors here. A public health specialist with more than 10 years working in public health for both government, ministerial level at Ministry of Health, and the donor-funded projects at the higher capacity in Ministry of Health at the Global Fund M&E lead. He designed planets and property monitoring implementation of the 3 successful Global Fund grants, and at his capacity of MML Director of USAID Afya Yangu program. He has designed a several data management initiative, a significant improved data availability, equality and use. His area for management, expertise, monitoring and evaluation, data management, program design and management, equality of improvement and capacity building. A round of applause as we welcome Dr. Dennis Mzaga. Our third presenter, our discussant, is Mr. Kenneth Chima. Kenneth Chima is a social scientist with over 20 years experience in project planning, implementation, monitoring, and evaluation through working with AMREF, CARE Tanzania, FHI 360, JAPIGO, and PACT Tanzania. He has rich in experience in implementation of community-based health, social welfare intervention, maternal health, including respectively maternal care, orphan, and vulnerable children. He has also had experience in healthy and social welfare system strengthening adolescent sexual and reproductive health systems. He has also expertise in social behavioral change communication, strategies and campaign, community participatory approaches, and community quality improvement agenda. Another round of applause as we welcome Mr. Kenneth Chima to his stage. And our last speaker is Ms. Mona Mapunda. Mona is a passionate development practice with other 4 years experience overseeing and leading development projects in multicultural and international contexts. Mona has worked with Canadian Physicians for Relief and AIDS, World Vision, UMAD, and now TCII to bring about desired change in communities, backed up with a development study degree from Sokoino University in 2009 to 2012, and they have extensive training in UTAC and SUCAS Business Forum, among others. She also have experience included nutrition capacity building, awareness raising in communities with other populations such as PLHIV, children under the age of 5, the elder and the pregnant women. A round of applause as welcome Ms. Mona to our stage. Welcome, Ms. Mona. Thank you. As we are waiting for Ms. Mona to take her seat, maybe I should also introduce the main part of our forum is based on making an impact that matters through private sector engagement in HIV response at the primary health care. To start our discussions, first we start with my director, Dr. Mfaume from the PRAJ. We want to discuss with him through his experience as a regional medical officer, district medical officer, but also currently he serves as a director at PRAJ, Department of Healthy, Social Welfare and the Nutrition Service. What are enabling environments for engagement of private sectors in primary healthcare service delivery? Concerned how the main part that we needed to know the impact of the matter through the private sector engagement in HIV response at primary care. Welcome, Dr. Mfaume. Can we have another mic, please?
So, good morning, everyone. Yes, thank you very much, moderator. Private sector engagement or non-state actors IF engagement is crucial in strengthening the health system, the resilient health systems, but the quality of health services in general. And we all know the role of the government is to provide these services. But we went through several phases. From independence, we all know, we tried to collaborate with the private sector in a pattern that is different from when we banned the private sector. Then during the reforms, we found it importance of engaging the private sector. So despite the fact that the government has that law, but cannot do it alone, we need the private sector to complement the government initiative. And we have to walk the talk on that aspect. The theme of this year's summit is advocating better practices. Now, better practices also comes with the practices in meaningful partnership. Now, the government has put down several enabling environments to ensure there is fruitful collaborations, mutual support, mutual trust that will be put into practice to provide the required or intended our targets or objectives, and in turn, the quality of health services to the communities. Let me start with the area of coordination. We all know, and for those who are being engaged in the technical working groups, at the ministerial level, there is a policy dialogue platforms whereby from the policy formulations, suggestions into the policy or strategy formulation, implementation, monitoring, evaluation, every resource mobilizations, including also community engagement, is discussed. So having this platform for engagement of the public and private in the sector-wide approach is very important. But from my experience, the question moderator was also to link with my experience. The sector-wide approach has been mentioned, or the intention of Sector Strategic Plan 5 was to decentralize sector-wide approach to the regions and to the districts. But we have not made much success in that area, so that's an area that we have to focus on, the public together with the private sector. But coming to the regional level and the district, their role as per the regional health management system guidelines and the council system guidelines, it also to create the enabling environment. So at the PO large also, we ensure that the subnational levels practice their roles of creating enabling environment in all stages of service delivery. From the planning, we have to plan together, pre-planning, planning, execution, monitoring, evaluation, and learning. The most important thing in that area is openness, transparency, mutual trust, including resources. That's from my experience point of view. But we have been improving in that area. Most of the working arrangement has been very transparent and trustful. But coming to the reforms, our reforms, as I said, has introduced or has created an environment, a good environment, conducive environment for private sector investment. Most of the policies act, let's just refer to our PPP policy of 2009, the PPP Act of 2010, and its amendment in 2014 and 2023. All these created are the documents that, if properly put into practice, the way the putting into practice is very important, very crucial. Having these documents is not enough. We all have to have that intention of putting it into practice. But also, the reforms came with healthcare financing modalities that will also create an environment for private sector to provide the services in a sustainable and productive manner, like prepayment schemes, the NHIF. The NHIF cut across from the public to the private, in order also to create an enabling environment for private healthcare financing. So coming to the health sector strategic plan 5, 2021-2026, it also, there are clear statements and objectives that also create or promote a conducive environment for private sector, including how can we work jointly to make sure that we increase access and utilization of health services in all pillars of health system strengthening. We promote the health commodity manufacturing, including medical equipment, medicines, and drug within the country, and even procuring directly from the industries, whether in the country or outside the country. So those investments are opportunities for investments from the private sector, and availability of those investment guidelines is also an environment that promotes conducive investment. But we have seen the working arrangement in a PPP service level agreements. There have been agreements in, for example, the government and faith-based organizations. But we have seen how the government also allocates staff and other resources to the private. Despite the fact that we are facing both challenges of the resources, but the little available resources we share. But the most important thing is the quality management systems stipulated under health sector strategic plans, like legislations. So apart from all those arrangements, we have to ensure the government that the quality of services, safety is being adhered. And even implementation of these quality management systems is also collaborative between the public and the government. Lastly, we all know on the context of how the PPP, the creating environment between the public and private in the provision of health services towards HIV prevention, care and treatment and support services. With the example of Deloitte under the support from PEFA, USAID, but working with the TMAC and the MDH. We really think that working arrangement has been very good, and that has been well put in place with a document like National Multi-Sectoral Strategic Framework that creates an environment also for working arrangement to make sure that the intended interventions in prevention, care and treatment and support services are being provided in the manner that has been jointly intended. So to sum up, the PPP is crucial. And we can see the Deloitte and the achievements presented here. They really show the real example and the benefit of working together, having the mutual trust. The umbrellas like Christian Social Service Commissions, I can see them there here, the Bakwatas, the COCO coalitions. We are working in a very harmonious environment. The most important thing is let's be transparent, mutual trust. Let's plan together. Let's synergize those resources. Thank you very much, moderator.
Thank you so much, Dr. Mfaume. As you remind us what the policy that's rated in HPCP5, which has are working currently, but also how the PPP is important to continue in the prevention of HIV, but also in working at the primary health care. The second panelist, Dr. Dennis, being an M&E specialist, but also you have experience, expertise on in managing and several data initiatives, and being also working a part of the government and current
health facilities that constitute around 8,329 people living with HIV. That means if at all private sector was a region, that means would have been the largest region that we support. In summary, of the 6 regions, the largest one is Iringa with around 486 people living with HIV receiving ART. So means having private sector supporting around 8,329. This means it's like the whole of Iringa and some councils in Njombe. So you can imagine how big private sector is specifically in our 6 supported region. Apart from having a larger number of people living with HIV receiving services around these areas in private sector, so we have other services that are provided like identifications that include screening for both HIV and TB. We have actual quality of service that is provided, because imagine if all these clients were receiving services in public, that means there could be a lot of congestion and possibly even ability to identify them all wouldn't have been achieved by now. But ensuring that these clients are recipient of services that are receiving services in public and private, actually receiving quality services. So in terms of prevention, we all know that our focus currently is to ensure we reach the hard to reach populations. And from the previous surveys, have shown that youth and men are the ones that are difficult to reach. And we thought it's important to engage private. These are the CSOs that engage the peers that went to hard to reach area. We call this hotspot. And for just 1 year, we managed to reach around 200,000 men and 230,000 youth. And these populations were provided with preventive educations, given condoms and screening for HIV, some were tested, and some were referred for PrEP and family planning to the nearby health facility. So this is something that is commendable. It's a very big achievement, specifically on HIV prevention. However, in care, HIV care provisions, we have very big health facilities in our supported regions. I can mention few like Ndanda, I think you are aware of, Peramio, St. Francis, where a large number of people go to these facilities to provide, to receive these services. So clients are normally screened and tested, and with this, we have been able to achieve this 27% coverage of people living with HIV in this health facility. So having around above 8,000 client on ART supported in these health facilities, by modeling and calculations that prevent new HIV infections, just by this year around 3,372. So this is a bigger number, if at all, contribution to ensure that new HIV infections are not transmitted this year. But for mother to child, we modeled and found that is around 900. So this is a very big contribution, specifically when we talk on HIV prevention. On HIV quality of service, the main focus is to ensure that the client actually are tested for HVL and get to know their status. HVL level. And we have around 7 big conventional hospitals with HVL testing machines. And out of those, 2 are from private health facility, which is Dreams in Iringa and St. Francis. And this, at times, they were the only ones which were running, and by far significantly contributed in availability of HVL results. But apart from HVL, we have gene expert machines in around 55 health facilities, and all those 16 private health facilities. So apart from HVL, we normally now significantly achieved on bacteriology confirmations for TB cases, around 66%, which is above standard, which is 65%. That's a very big achievement. We've been able to test early infant diagnosis below 2 months of age for above, coverage is above 93%. And appreciate HVL suppressions by now is above 98%. So you can see the contribution specifically, not only enriching, but ensuring the quality of services is properly provided, and we could appreciate. But identifying, put client on ART is one, but ensuring that they are retained is another thing. So we have several programs that engages CSOs to ensure that when one is in ART, we have peer to ensure that CBHS, these clients are tracked, are followed, ensure that they are there to HIV medications, to ensure that HIV is suppressed, quality of life is improved, and transmission is reduced. So these are some of the things that we've been able to appreciate. I know there are challenges, but what we have been able to realize by now is significantly enough to say that public-private partnership is actually working, specifically on HIV service provision. Thank you.
Thank you so much, Dr. Dennis, for well narrated what's been done currently to support the public and private facility in service delivering for HIV. As we know all that we are currently at a call for sustainability on HIV program, but apart from what government has been done through preparation of the roadmap for HIV sustainability, but also in the call for all the private sector also to be engaged in that roadmap that can able also to make a sustainable of this HIV activity that was being expected toward the end of HIV in 2030. Come to this, maybe I call to ask Mona, Miss Mona, through that experience that she has in working in a private sector, but also in supporting all the initiatives that have been laid with the government in HIV